Okay, we are live. We are live. Welcome to Medication Monday. What psychiatric medications cannot do? What you may already know about me is that I am a registered nurse. I've worked in healthcare for more than 3 decades, caring for adults and children in critical care settings, leading clinical programs, participating in the allocation of hearts and lungs for transplantation, and advocating for health equity. But what you may not know is that I also became the patient. Between 2012 and 2016, while working inside a major U.S. hospital, I experienced discrimination, the severest form of chronic job stress that I know. It began with a repetitive stress injury that left me unable to continue performing the same job. I was placed on workers' compensation. Eventually, the workers' compensation doctor released me to return to work. I'll never forget watching what that corporate doctor wrote in all caps. Return to work. No more than lifting 10 pounds. No more than 10 minutes of keyboarding activity per hour permanently. 0% rating. What happened next changed the course of my life and my career. With a documented disability, I found myself trying to navigate the Americans with Disability Act, the Family and Medical Leave Act, and the Equal Employment Opportunity Commission, largely on my own. In the second year of what became a 4 year ordeal, I found myself sitting in a psychiatric office, sitting on the couch, crying, overwhelmed, desperate, scared. Everything I had worked so hard to build felt like it was slipping away through my weakened hand. Then I made a decision. I decided to trust Yahweh. That decision turned my situation around. Today, I stand before you as the founder, CEO, and visionary at Glenae's RX for Life, the author of Well Done, Hood Girl to Head Nurse, and Operation Mental Health, practical lessons on career burnout and recovery, and the innovator of workforce care. What happened to me is still happening to employees like you every day. That's why I'm committed to helping Black career women, registered nurses, and believers in God understand workplace stress, protect their health, and choose the narrow way that leads to life. Let's get into today's lesson. Maybe you're asking yourself a question. Maybe you're going through some workplace issues. Maybe you are overwhelmed and enough is enough. You can't keep going on this way. You're sitting in the car, exhausted, don't want to deal with traffic, need the paycheck, need a moment before you go into the house, and you're wondering about taking FMLA and you're looking for a psychiatric nurse practitioner to go to your doctor, and you have these things happening to you in the workplace that's impacting you, your total body, your mind, your emotions, your spirit, your physical health. You're exhausted and you don't know what else to do. So you ask, is taking psychiatric medication the right decision for me? If you're living with a mental illness, psychiatric medication might very well be the appropriate part of a treatment plan. My specialty is different. My specialty is helping you understand workplace depression, career burnout, and work fatigue so you can distinguish workplace depression from clinical depression before making any major decisions about your health, your career, and your future. Workplace depression and clinical depression are not one of the same. Workplace depression can come from being oppressed in the workplace. Workplace depression can come from carrying too many burdens in the workplace. Workplace depression can come from being denied workplace rights, being held back, being micromanaged, being ostracized, being bullied and harassed, sexually harassed, shamed in the workplace. That's workplace depression. Clinical depression, on the other hand, is something totally different. Before making your major decisions about your health, your career, and your future, you should not want to sit with the same doctor who treats clinical depression when your symptoms are from workplace depression. So, if you're on the fence about whether you should take psychiatric medications, you need to know why. What is your why? What are you hoping to gain or to lose by taking psychiatric medications? You need to understand the potential benefits. You also need to understand the potential risk. And you need to assess your personal circumstances. Psychiatric medications are not a one size fit all. Psychiatric medications are significant medical interventions, invasive medical therapy that permeates through your body, that passes the blood brain barrier. Is not insignificant, very significant. They should never be taken or entered into lightly. One concern many people report is emotional blunting, a reduced ability to experience positive emotions such as joy. Some women describe difficulty tapering and discontinuing SSNR, SNRIs and SSRIs, two types of antidepressants. This is why informed consent matters. I know that you're scared. I know that you are flustered. I know that you are trying to do what the process is so that you keep good graces within the workplace and that you don't burn bridges and that you don't upset anyone. But aren't you valuable? Aren't you worth somebody getting upset about? But here's my workforce care question. If your distress, your workplace depression began at work, have you treated the workplace? Or are you only willing to treat your symptoms? Did you plan on quitting the job, abandoning what may be at your table? Remember, God sets a table in the presence of your enemies. If stress and struggle is going on in the workplace and there are policies and laws in the midst of it, and you are thinking about psychiatric care, psychiatry, psych means soul. That is a strong indication that you should consider your soul, consider your soul, and do what scares you. Do the thing that fears you. Do what you need to do to move past the stressor and into your promised land. Do not take medications for workplace depression when your symptoms are coming from being oppressed in the workplace, being micromanaged, mislabeled, misunderstood, anything that is impressing you and depressing you that is happening in the workplace. This is different from clinical depression. Should you be seeing the same doctor for workplace depression as you see for clinical depression? So if you're only treating your symptoms that you're describing and not treating the workplace, which is the root cause, things are going to remain unchanged. You want change to occur. You may still be returning to the same environment that contributed to the workplace depression, the distress that occurred in the first place. Now, let's move beyond the clinical discussion and let's talk about the spiritual side. There are no There are questions no medication, no prescribing doctor can answer for you. Questions like, am I compromising my values? Am I obeying or disobeying God? Is the workplace harming me? Should I take FMLA? Do I need an ADA accommodation? Am I experiencing discrimination? Should I stay or should I leave? What is the root cause of my distress? What is happening to me? Medications can influence mood. Medications like psych medications cannot determine your purpose. Medication cannot discern truth. Medication cannot make moral decisions. Medications cannot decide whether your workplace is safe for you. Medication cannot tell you whether your conscience is being violated. As your workforce care nurse, I want you to understand the difference. Do not medicate what God is trying to elevate through you. If you're distressed, your workplace depression began as a workplace event, don't stop at symptom management. Slow down. Ask yourself. Pray. Ask God, what's going on, G? What's happening? What changed? What am I trying to cope with? Remember, cope. A lot of people today use the word cope as a way to tolerate. Cope is not to tolerate. Cope means to contend until you overcome, to meet pressure with pressure, force with force until you overcome. As nurses, we're taught to do an assessment before we diagnose the situation. And then after we diagnose the situation, we plan and we intervene. Why? Because treatment should match the problem that's causing the symptom, not just masking the symptom. The same principle applies to you in your workplace situation. Let's do an assessment before they medically diagnose you based off of your symptoms. Let's do an interpretation of what's happening. Let's run through some scenarios before an intervention. Let's learn how to practice faith in the workplace because without faith, it's impossible to please God. Medication may be an appropriate part of someone else's treatment plan, but there is a difference between workplace depression and clinical depression. Before accepting medical treatment for workplace distress, that is, workplace depression caused by oppression happening to you in the workplace, make sure that you have a clear understanding of the root cause. One of the first questions I learned to ask as a nurse was, what problem is this intervention intended to solve? Medicating myself for workplace issues to try to hold on to my worldly possessions and everything that I worked so hard for was more damaging to me than learning how to spiritually let go, follow the truth of my situation, and be led to a better life. I believe you deserve that same level of clinical reasoning before making major decisions about your health, your career, and your future that could impact your family, that can impact the way that you live your life. My hope for you is that you make informed decisions, that you get the information that you need to protect your health, your employability, and your relationship with the Most High God. I'm Glenna Davis, registered nurse, and I want you to know that paying attention to you is the new standard of care. If you have any questions, comments, please leave them in the comments. Share this with someone who may need to know about workforce care.